The major pertinent concern I have observed over time is I know much as we need hardware, software is very, very crucial. There is still a gap in software. Software in situations of people-centered skills. We have a gap, or the hospital has a gap in software concept where they are able to manage the communities that come to seek for services. And so because of that, those could be concerns like issues of language barrier, issues of communication, issues of empathy while you are communicating to sick people, to mention but a few. And for me, my question to the hospital management is, are there avenues where our staff are taken to acquire some of these skills so that we curb on some of these gaps?
Basic information. So one is we keep having stockouts in the hospital, year in, year out. I understand that Moroto Referral Hospital has an annual budget of about 1.5 billion. And then every time we're having stockouts, it's especially prone in places like maternity ward. Sometimes they make mothers buy gloves, otherwise you're not attended to. Imagine mothers in labor, and then you're told if you can't bring gloves, we can't attend to you. And then we have an issue of broken machines. Honestly, this one, the X-ray machine has been down from 2023. It's coming to almost 2-3 years now, and we all know that this is the only machine that serves the whole of Karamoja. So sometimes that people come all the way from Kotido. You reach here, you're told the machine is down. So again, you have to be referred to Matan. So you see what we're exposing our patients to. What is so complicated about the machine that's taking over 3 years to work on? I think we are not serving the people that we are supposed to serve. When it comes to ultrasound scan, it's always breaking as well. I hear currently it was repaired. It has also been down. And when you look at this machine, it's also serving almost everyone in the region. We're talking about the whole of Karamoja. I understand that there are machines in Nadunget Health Center that are redundant, like ultrasound. They are not doing anything. There is no doctor to operate. Why don't we co-opt some of these machines to support the regional referral? When you look at maternity, I would think that we would actually have an ultrasound scan dedicated to maternity ward instead of mothers coming to line up in the same OPD as the rest of the patients. Sometimes maternity is more of an emergency place. When you look at the people sometimes who die as well, Moroto municipality acquired public cemetery, but it's not being utilized. People abandon bodies here. So the office of mayor, kindly, I don't know how you can help abandon bodies to get taken the other side. You took a visit to the morgue. The morgue we have is still a normal house. We all know what happens to bodies when people die. Why don't we put a modern, morgue to facilitate or to take care of our dead bodies? I know they are dead, but we treat them as with respect. And then when you look at some wards, you took a walk, you look at surgical ward. Does it look like a place that has patients? Actually, it can easily collapse on your patients, and I don't know how you call the same patients.
Now, we are talking about services. Now, in every kind of institution or service, there are requirements in order for you to deliver an effective service. There are things that must be in place, all right? If those things are not in place, if they are lacking, or if only a few of them are there, definitely the quality and the quantity of services that you're able to deliver will be affected. And there are very specific things, even in the health service delivery, which are required. Number one, if I can run very quickly, about 5 of them. One is infrastructure. There has got to be buildings, there have got to be equipments, there have got to be vehicles, there have got to be all these things. Now, when these are lacking, definitely the quality of service will be affected. We have talked about the X-rays, okay? We have talked about the CT scan. We have talked of many others, okay? Now, but when we went around, actually there are a lot of equipment in this hospital. Yeah, it's really fully equipped. So there are a bit of gaps. And when those gaps are there, the quality will definitely be affected. Number 2 is human resource. You need to have the people to deliver a service. I think this is true for any sector, all right? So if you have 1,000 people, if you are supposed to have 1,000 and you have 300, definitely the level of your service will be affected. Number 3 is supplies, sundries, all these other things that we need, drugs. Okay, we have been talking from here. We are lucky we went to the pharmacy and looked stocked, okay? But the head of was saying sometimes they don't get the medicines they don't have. So if I prescribe to you and say go and buy this medicine because we don't have it, what else can be done, isn't it? Yeah, what else can be done? So sometimes that happens. Of course, we don't want it to happen, but it does happen, okay? So we need supplies, we need drugs, we need sundries, we need all these things in order to deliver a quality service. The other one is information, okay? Information system, data records, data collection, research. Even what we are doing today here, this is collection of information which fits into management, which fits into decision making so that we improve. Last but not least is leadership and governance, all right? So we need the board to be in place, we need the management to be in board, and lower management committees should also be. So when all this is together, then we can deliver a service. But we know there are gaps, isn't it? And that will affect service delivery.
The government of Uganda, Ministry of Health, has put in place community engagement strategy, community health strategy, which among the aims is to ensure that we support the decentralized service delivery mode in which we operate, which emphasizes participation, collaborating with the communities, and ensuring transparency and accountability for the community, and participation in the management of services in the hospital and also their own health. So that's the aim of this Baraza, is to first of all to get the feedback from the communities. How do they feel about the services that they are being given? Are there areas that they feel they are not being helped adequately? Are there areas that we need to improve? Are there areas that the hospital is not doing as well as they expect from us? So it's under the quality improvement framework of government of Uganda, whereby we want to get feedback from the people and know whether we are reaching the expectations of the communities. So that's what is aimed at in this Baraza. We also had it discussed in the board, and the board said that we should have the Barazas and community engagement interventions to ensure whatever we do in the hospital is shared with the community as much as possible, and in a very transparent manner, without hiding anything.